Hi there, Todd Cameron here, GP and Medical Director at M3 Health. You're receiving this video because your GP and probably you have determined that putting together an advanced care directive would be ideal in your circumstances. So what's an advanced care directive? Well, an advanced care directive is not a new thing. It has been around for a long time. And often you will have had conversations like this with your GP or even your family in the past. An advanced care directive is determined how you would like to be treated medically and otherwise in the event that you are no longer able to make decisions for yourself. So this is really important because although it often involves a lot of really hard conversations with your loved ones and perhaps even with your GP, what's important is that the people around you know what your expectations are, and that reduces a lot of stress for them because in advance they've already thought about and had the conversations and hopefully have the formal documentation that outlines what it is you would like done for you in the event that you weren't able to make decisions about your own healthcare needs. There will be a link to one of the government pages where all of the details of advanced care directives are outlined. In an ideal world, you complete the advanced care directive in conversations with your family and your GP, and at the end of it, you would sign it, and usually your GP would sign it. Ideally, that is uploaded into My Health Record, which is the government repository for all of the patient files. In an ideal world, that remains there, and if somebody needed to access it at short notice, they can, but you should always keep a paper copy that can go with you as well. So make sure you look at the rest of the information that came through with this message. This is about making sure that all of us are as prepared as we can be, and if we ignore this, what it means is we're putting the workload onto other people around us that love and care for us, and at a time that they will be highly stressed and obviously have a lot of overwhelm, we're causing them or we're forcing them to make decisions that they will be uncertain about. So let's do the right thing, make those decisions ourselves while we can in consultation with our family, and then ratify that with your GP. Make sure you read all of the documentation that came through with this message on the available link. I've been Todd Cameron. Thanks for your time. Bye.